Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear a GP talking to a patient called Henderson. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hi, Mr. Henderson. How are you feeling today?
Hello, Dr. Patel. I'm actually a bit concerned. My son Alex has developed this rash on his face. At first, I thought it was just a reaction to something, but now it seems to be spreading. He's not acting very sick, but I just want to make sure it's nothing serious.
I see. How long has Alex had the rash?
It started about 3 days ago. At first, it was just a bit of redness on his cheeks, almost like he had been slapped. But yesterday, I noticed it spreading to his arms and legs. It's not as bright on those areas, though.
That sounds like it could be fifth disease. It's quite common in children. Has Alex had any other symptoms, like a fever, or maybe a runny nose, before the rash appeared?
Yes, actually. About a week before the rash showed up, he had a mild fever. It wasn't too high, so I didn't think much of it. He seemed a little tired and had a runny nose, but I thought it was just a cold. Could that be related to this rash?
Yes, it's likely related. Fifth disease, or slap cheek syndrome, often starts with cold-like symptoms, fever, mild cough, or runny nose. After a few days, the distinctive red rash on the face appears, followed by the rash on other parts of the body, like the arms, legs, and sometimes the torso. The rash can come and go for a couple of weeks, especially if the child gets too warm or is out in the sun.
That's exactly what's happening. The redness gets worse when he's playing outside, but he doesn't seem too bothered by it.
That's good to hear. Fifth disease is usually mild in children and tends to resolve on its own without needing any specific treatment. The virus behind it is called parvovirus B19, and once Alex's body fights it off, he should be fine. In most cases, children recover without any lasting problems.
Oh, that's a relief. So, there's no need for medication? Do we need to stay home for a while?
There's no need for antibiotics, since this is caused by a virus. We usually focus on keeping the child comfortable. You can give Alex some paracetamol or ibuprofen if he seems uncomfortable, but it doesn't sound like he's in much pain. Make sure he stays hydrated and keep him out of the sun or excessive heat, as it can make the rash flare up. As for staying home, by the time the rash appears, children are no longer contagious. Fifth disease spreads before the rash develops during the cold-like phase. So, Alex can still go to school or daycare if he's feeling well enough.
Oh, I didn't realize that. I've been keeping him home because of the rash.
That's understandable. It looks alarming, but it's harmless at this stage. It's really during the incubation period, when they show cold symptoms, that they're contagious. but since the fever and runny nose have passed, he's no longer spreading the virus.
That's good to know. Is there anything I should watch out for, just in case?
In most cases, there's nothing to worry about. The rash might come and go, especially with changes in temperature, but it usually fades after 1 to 2 weeks. However, if Alex seems to develop joint pain, or if the rash persists for more than 3 weeks, it's a good idea to come back for a follow-up. Also, if he suddenly seems unwell, fatigued, or has trouble breathing, you should bring him in. These are rare, but it's good to be aware. If anyone in your family is pregnant or has a weakened immune system, let them know about Alex's illness. Fifth disease can cause complications in people with certain conditions, though this is also uncommon.
Oh, my sister is pregnant actually. Should I tell her?
Yes, it's best to let her know, especially if she hasn't had fifth disease before. Most adults have already been exposed to the virus and are immune, but pregnant women who aren't immune should be cautious. The virus can occasionally affect the unborn baby, so it's important for her to contact her healthcare provider for guidance.
I'll let her know. Thank you so much for explaining everything. I feel a lot better now. I was worried this might be something more serious.
You're welcome, Mr. Henderson. It's always best to check, especially with young children. If you notice anything unusual, or if the symptoms change, don't hesitate to come back. Otherwise, Alex should be back to normal soon.
That's great to hear. Thanks again, Doctor.
My pleasure. Take care, and I'll see you again if you have any more concerns.
Extract 2, questions 13 to 24. You hear a doctor talking to a patient called Mr. Grant. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes. Good afternoon, Mr. Grant. I'm Dr. Elias, one of the physicians here at the hospital. I've come to discuss your current symptoms and understand what's been going on. Could you start by telling me why you came in today?
Hi, doctor. I came in because I've been feeling really unwell, feverish, weak, and my heart has been racing for the past couple of days.
I'm sorry to hear that. When did these symptoms start?
It started about 3 days ago. I initially thought it was just a bad cold, but it kept getting worse.
I see. Did you notice anything unusual before these symptoms began, like an infection, cut, or any other illness?
Yes, actually. About a week ago, I had a small cut on my leg from working in the garden. I cleaned it up, but it got red and swollen after a few days.
That's important to note. Did you see any discharge or pus coming from the cut?
Yes, it started leaking some yellowish fluid 2 days ago, and it's been painful to touch.
Okay, and besides the fever and weakness, have you had any other symptoms, such as chills, confusion, shortness of breath, or a rapid heartbeat?
Yeah, I've been shivering a lot, and yesterday I got really confused. I couldn't even remember where I put my car keys, and that's not like me. My heart has also been racing, and I've been breathing faster than normal.
Those are concerning symptoms. Have you noticed any changes in your urine output, like going less frequently or dark-colored urine?
I haven't really been drinking much water because I've felt so nauseous, and I haven't needed to go to the bathroom as much.
Thank you for sharing that. Let's talk a bit about your past medical history. Have you ever been hospitalized for any major illnesses or surgeries before?
I've had high blood pressure for years, and about 5 years ago, I had my gallbladder removed. Other than that, I've been relatively healthy.
And are you currently taking any medications, including over-the-counter drugs or supplements?
Just my blood pressure medication and a daily multivitamin.
All right, Mr. Grant. Based on your symptoms, fever, chills, rapid heart rate, confusion, and the infected cut, it seems like you might be dealing with sepsis, which is a severe reaction to an infection in your body. Have you ever heard of sepsis before?
I've heard the term, but don't really know much about it.
Sepsis happens when your body's response to an infection triggers inflammation throughout the body, which can lead to tissue damage and organ dysfunction if not treated promptly. In your case, it looks like the infection from your leg wound might have spread into your bloodstream.
That sounds serious. How do we fix it?
It is serious, but we are on it. The first steps are to confirm the diagnosis with some blood tests, which will help us check for infection markers, your organ function, and overall severity. We'll also start you on broad-spectrum antibiotics to fight the infection, and we may need to give you fluids through and for to help stabilize your blood pressure and support your organs.
Is there anything else I need to be aware of?
We'll be monitoring you closely. The key is catching it early, which we've done, so we are already ahead. We might need to adjust the antibiotics based on the results of your blood tests, and if necessary, perform further imaging to check for any abscesses or areas that might need surgical attention. Have you experienced anything like this before?
No, this is all new to me. I just thought I'd feel better after a few days, but it's been getting worse.
It's good that you came in. Sepsis can escalate quickly, but with prompt treatment, many people recover fully. Do you have any questions or concerns about the treatment plan?
I'm just worried about my family. I don't want this to get worse.
That's completely understandable. We are taking every measure to ensure that you get the best care. Once we get you stable and on the right medications, you should start feeling better. I'll keep your family updated as well.
Thank you, doctor. I appreciate it.
You're welcome. We'll do everything we can to help you recover quickly. Let's get started with those tests and treatments now.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a doctor talking to a nurse about a patient. Now read the question.
This patient has been on the ventilator for over 48 hours now. His oxygen saturation has been stable, around 94%, which is good. We adjusted the PEEP slightly yesterday to maintain lung expansion, and that seemed to help. How are his breath sounds today?
They're clear on the right side, but diminished on the left.
Okay, diminished on the left. Any changes in sputum production?
It's increased slightly in volume, but no change in color.
So, no signs of infection for now. What about his chest X-ray from this morning?
It shows a small area of collapse on the left lower lobe.
Right, a small atelectasis. If it doesn't resolve soon, we may need to consider bronchoscopy. Is he coughing spontaneously?
No, not spontaneously.
Okay. We'll monitor closely to ensure it doesn't worsen. Let's also increase the frequency of chest physiotherapy to assist with lung expansion. If there's still no improvement, we might need to reassess his overall ventilation strategy and consider adjusting the settings further.
Now look at question 26. You hear a doctor speaking to a patient who has come in with a severe headache. Now, read the question.
Experiencing any nausea with the headache?
Yes, I felt quite sick to my stomach.
I see. How long have you been dealing with this headache?
It started about 2 days ago and has been getting worse.
Did you try taking any over-the-counter painkillers?
Yes, I took some aspirin, but it didn't help much.
All right. I'm going to check your blood pressure to see if that's contributing to the headache. Your blood pressure is quite high, which could be the cause of the headache and nausea. Given these symptoms, I'm going to start you on an intravenous medication to help lower your blood pressure and relieve your symptoms more effectively. We'll also monitor you closely to ensure that your condition improves and that the medication is working as expected. If necessary, we'll adjust your treatment plan accordingly.
Now look at question 27. You hear a hospital administrator introducing a professional development seminar. Now, read the question.
Welcome to this seminar, Effective Communication in Healthcare Settings. My name is Lisa Green, and I'm the Chief Administrator of the Patient Relations Department. Today's seminar is not just about improving your speaking skills. I believe that effective communication involves active listening, empathy, and clarity in every interaction. It is essential for building strong patient relationships and fostering a sense of trust. Effective communication is at the heart of patient care, and any misunderstanding or lack of clear communication can lead to mistakes, misdiagnoses, and patient dissatisfaction. Our goal today is to help you improve your ability to communicate effectively with patients and colleagues. This includes developing the skills to listen attentively, convey information clearly, and show empathy in your interactions. By the end of this seminar, you will be better equipped to handle challenging conversations, improve patient outcomes, and foster teamwork within your healthcare environment. These skills are not just beneficial for patient care, but they also enhance collaboration among healthcare professionals, creating a more cohesive and efficient working environment.
Now look at question 28. You hear a nurse speaking to a cardiologist about a patient. Now read the question.
This is Mr. Thompson. He came in this morning complaining of severe chest pain that radiates to his left arm. He says the pain started about an hour ago while he was gardening.
Has he experienced anything like this before?
He mentioned occasional chest discomfort in the past, but nothing as severe as today. When we assessed him, he was diaphoretic, with a blood pressure of 150/95 and a heart rate of 105. We've already given him 300 milligrams of aspirin, and his initial ECG shows ST elevation in leads 2, 3, and AVF, indicating a potential inferior myocardial infarction.
Any changes after the aspirin?
Not much. He still reports pain. We also administered 5 milligrams of morphine, and his pain has decreased slightly. We're preparing him for a troponin test and continuous cardiac monitoring to further assess the extent of myocardial damage and guide our next steps in his treatment.
Now look at question 29. You hear a nurse instructing a junior colleague on how to care for a post-operative patient. Now
Okay, let's review the patient's post-op care. The surgery went smoothly, but we need to be vigilant about a few things. I'm particularly concerned about any signs of infection at the incision site, so keep an eye out for redness, swelling, or any unusual discharge. Infection can develop quickly and can complicate the recovery process, so it's crucial to monitor this closely, but also, we must monitor for other complications that might not be so visible. The patient had some trouble with his blood pressure during the procedure, which makes him more susceptible to post-op issues. There's also a risk of post-op pneumonia, so listen carefully for any abnormal lung sounds. Early detection is key, as pneumonia can significantly impact the patient's recovery time and overall health. Ensure the IV fluids are running correctly and that his hydration levels are maintained, as this is essential for recovery. Check his vitals every hour to catch any early signs of complications. We'll also need to ensure he's getting enough pain relief, but we have to balance this carefully to avoid over-medicating him. Pain management is critical, but we need to avoid any potential side effects from the medication.
Now look at question 30. You hear a nurse discussing a patient's condition with a colleague. Now read the question.
On Mrs. Thompson.
Sure, what's going on?
Well, her blood pressure is still elevated despite the new medication we started yesterday, but at least her heart rate has stabilized, which is a good sign. However, she's still complaining about dizziness, which might be a side effect of the medication, and the swelling in her legs hasn't gone down much, so we'll need to keep an eye on that. The edema could indicate that her body is still retaining fluid, so we might need to adjust her treatment. We've also been monitoring her kidney function closely, and the results are showing some improvement, though it's still not within the normal range. This is encouraging, but we need to continue monitoring her renal function to ensure it continues to improve. I've already let Dr. Patel know about these developments.
Okay, so she's still being monitored closely?
Yes, she's under close observation, and they're going to do another round of blood work in the morning to reassess her kidney function.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear a doctor giving a detailed presentation on sedentary lifestyle. You now have 90 seconds to read questions.
Good evening. I'm Dr. Sandra Mitchell, and today I want to talk about a topic that's affecting more of us than ever before: the dangers of a sedentary lifestyle. In this discussion, I'll be sharing what we know about the risks of prolonged sitting and inactivity, and we'll also tackle some of the misinformation out there about what really counts as healthy movement. Let's start with a simple question: why does sitting matter? It seems innocent enough, right? We sit when we work, when we relax, and often when we eat. But the truth is, the best available evidence shows that a sedentary lifestyle, defined as too much sitting and too little physical activity, is a significant risk factor for many chronic diseases, including heart disease, diabetes, and even some cancers. The problem isn't just the lack of exercise, it's the extended periods of sitting itself. Even if you exercise regularly, prolonged sitting can still have harmful effects on your body. So what's the big deal with sitting? When we sit, our bodies essentially go into rest mode, slowing down our metabolism, decreasing insulin sensitivity, and reducing blood flow. In other words, sitting for too long makes it easier for our bodies to gain weight, develop high blood sugar, and accumulate unhealthy fat around our organs. Some researchers even refer to prolonged sitting as the new smoking, not because it's the same exact risk, but because it's becoming one of the biggest public health threats of our time. But why is there so much conflicting information on this? Well, part of the problem is that modern culture glorifies convenience and comfort. We've created an environment where almost everything is within reach, and we rarely have to move to get anything done. Plus, the fitness and wellness industry often promote quick fixes, like one workout a day or standing desks, as though these can fully negate the hours we spend sitting. But the reality is, it's not just about hitting the gym once a day or swapping your chair for a standing desk. It's about integrating movement into your entire day. And that's where the debate gets complicated. For example, you might see articles saying that standing desks are the solution, but standing all day comes with its own set of problems, such as varicose veins and joint pain. Or you'll see recommendations that a 30-minute workout can cancel out a day of sitting. Unfortunately, that's not quite true. The best evidence suggests that breaking up long periods of sitting with short, frequent bouts of movement, like standing up every 30 minutes, taking short walks, or even doing light stretching, is the most effective way to counteract the negative effects of sitting. So, why do people cling to these myths? Well, just like with dietary fads, there are powerful industries and marketing forces at play. The office furniture industry, for example, has a vested interest in selling standing desks, ergonomic chairs, and other equipment marketed as health solutions. Similarly, fitness apps and gadgets often push the idea that a single exercise session can make up for a sedentary lifestyle. But it's crucial to remember that these are often profit-driven narratives, not evidence-based solutions. Look at it this way: the most compelling data we have comes from population studies, like those looking at blue zones, regions around the world where people live the longest, healthiest lives. In these areas, people don't necessarily go to the gym, but they move naturally throughout the day. They walk, garden, and perform daily chores that keep them active. The key takeaway is not necessarily the intensity of the movement, but the consistency and integration of movement into everyday life. For example, in Okinawa, Japan, one of the famous blue zones, elderly individuals are still active well into their 90 seconds because they live in environments that encourage movement. They sit on the floor, which means they naturally get up and down many times a day. This kind of natural, integrated movement is far more beneficial than simply exercising for an hour and then sitting the rest of the day. So, the message is clear: we need to rethink how we approach physical activity. It's not just about the gym or standing desks, it's about building a lifestyle that prioritizes movement in all forms.
Extract 2. Questions 37 to 42. You hear a doctor giving a presentation on medication non-adherence. Now, read the questions. You now have 90 seconds to read questions.
Hi, I'm Dr. Lisa Marlowe from the Department of Public Health at Central Medical University. Today, I want to highlight a pressing issue that's impacting patients and healthcare providers alike: the growing concern of medication non-adherence. It's a widespread problem that doesn't get enough attention, and I believe it's time to start a conversation about why patients aren't taking their medications as prescribed. So, what is medication non-adherence? It's a scenario where patients don't follow their prescribed medication regimen. This could mean they're not taking their medications at the right time, not taking the correct dose, or even not taking them at all. Non-adherence is not just about forgetting to take a pill now and then. It's a chronic issue that significantly affects patient outcomes and healthcare costs. A study published in the Annals of Internal Medicine found that 20 to 30% of medication prescriptions are never filled, and around 50% of medications for chronic diseases are not taken as prescribed. Non-adherence leads to approximately 125,000 deaths per year in the United States alone and is responsible for 10% of hospitalizations. This is a huge problem, not just for individual health, but for the healthcare system overall. It costs the US healthcare system nearly $300 billion annually. Why does this happen? Well, there are many factors. Some patients struggle with the complexity of their medication regimens, especially when they have multiple prescriptions. Others might stop taking their medications due to unpleasant side effects, or because they start to feel better and wrongly assume they no longer need the medication. Financial barriers are also a big reason. The high cost of drugs can prevent patients from filling their prescriptions consistently. Lastly, there is often a lack of communication between patients and healthcare providers, leading to misunderstandings about the importance of adhering to treatment plans. The consequences are serious. Non-adherence can worsen disease progression, lead to unnecessary complications, and significantly reduce quality of life. For example, in patients with chronic conditions like hypertension, non-adherence can lead to uncontrolled blood pressure, increasing the risk of heart attacks and strokes. For diabetic patients, it can result in poor glucose control, leading to severe complications like kidney failure or blindness. For mental health patients, not taking prescribed medications can result in relapses or worsening symptoms. Healthcare providers also suffer due to medication non-adherence. They are often left dealing with the fallout when patients fail to follow treatment plans, leading to repeated hospital visits and deteriorating health. It's frustrating for doctors to see their efforts undermined by something as preventable as non-adherence. So, what can be done? First, we need to improve patient education. Patients must understand why their medications are essential, what the side effects might be, and how to manage them. Pharmacists and healthcare providers should make it a point to educate patients on the importance of sticking to their medication schedules and how non-adherence could harm their health. Another key strategy is to simplify medication regimens. Where possible, doctors should prescribe once-daily medications or combination pills that reduce the number of medications a patient needs to take. This can make it easier for patients to remember and adhere to their prescriptions. Financial barriers also need to be addressed. Many patients struggle with the high cost of medications, so healthcare providers and policymakers should work towards making medications more affordable. This could involve negotiating better drug prices, providing subsidies, or exploring generic alternatives. Digital solutions like medication reminders via apps can also play a role. Many patients benefit from digital aids that remind them when to take their medications, keep track of their doses, and alert them when they miss a dose. Telemedicine consultations can also help by providing ongoing support and follow-ups to ensure patients are staying on track with their treatment plans. Another approach is to enhance patient-provider communication. Open conversations about medication concerns, side effects, and barriers are crucial. This dialogue can help address any fears or misconceptions patients may have about their medications. Support groups and peer mentoring programs can also provide encouragement and accountability. In the end, medication adherence isn't just a patient problem, it's a healthcare system problem that requires a multi-pronged approach. By implementing strategies to support adherence, we can help improve health outcomes, reduce hospitalizations, and save lives. We owe it to our patients to make it as easy as possible for them to follow their prescribed treatments. Medication non-adherence is preventable, and with the right strategies, we can make a significant difference. This is an area that needs more focus, more resources, and more innovation. The stakes are simply too high to ignore it any longer.
That is the end of Part C. You now have 2 minutes to check your answers.